Okay, so the skull. What? Guys, don't start a lot of walking. Y'all walk too much in this class for me. It distracts me. So where exactly did we stop? I'm going to make sure this recording is on. So make sure you listen to the integrity recordings as well. So you know we have 22 skull bones. Of course, there's something going on with Blackboard today. God, dog it. Um, huh? So what? No, it's like that's my computer, I guess. I think it's my laptop. I'm not concerned about that. I'm trying to get this lecture. But anyway, this thing had better not stop working on me. Jesus. So you know you have 4 sinuses, right? They're definitely probably on your final exam. The frontal, the sphenoid, the ethmoid, and your maxillary sinuses, they're little air cells. I was telling, is this what you're talking about? Why? Oh, Lord. I don't know. I mean, it looks fine on my, I don't know why it's doing that. Maybe it's something going on with that thing, but I'm not about to get up there and deal with it. But I'll just, do it this way. I'll just do it this way. So, hey guys, the frontal bone, I don't know if I started on the frontal bone. I mean, hey, this is the best that I can do. I don't know, there's something going on probably with Blackboard today. I need to call the IT guy to find out. But anyway, so this is the frontal bone. That's all I can tell you. You can palpate it. Your forehead, this little smooth surface right here is called the glabella. The frontal bone, you have a coronal or frontal suture going across the frontal bone, which is actually here. You actually have 4 sutures you need to be familiar with. This one is your frontal or your coronal suture. Your frontal bone, the suture kind of connects the frontal bone with the 2 parietal bones right here. So it starts at the supraorbital margin, which is this part right here that you can palpate, and it kind of goes back. Okay. You also have your frontal sinus with that particular bone as well. I was telling my students on yesterday, frontal sinuses, you know, with allergies going on probably starting in March. I personally get a lot of sinus headaches. However, some people, we don't have a frontal sinus, but however, most of us do. So I am one of those people. All right. We talked about the 3 cranial fossas. When you guys get to anatomy 202, you're going to talk about the different lobes, the frontal, the temporal lobe, as well as the cerebellum. Now, you know there are 2 parts. Well, this is the skull or the cranium, aka your skull. This is the base. This is the calvaria or your skull cap. Now, the brain sits in here. This skull cap covers the brain. Any swelling that occurs in the brain, of course, you know, what is this hole called? Because it's on your test today. The foramen magnum. Okay, if you have some swelling going on with your brain, the brain tissue can actually come out, the foramen magnum, and of course can be fatal consequences, aka death. Okay, and it has this here. Okay, whatever. That one is better. So these are on your test today. Your 4 sutures here. Like I said, this is your frontal right here, or your coronal. You have your squamous suture on the side, which is up here. This one right here is your squamous suture. It's typically right above the temporal bone. It's also called the temporal suture. It's above the temporal bone, which is that purple bone that you see, and it kind of connects the temporal bone with your parietal bone. The lambdoid suture, which is the posterior part right above the occipital bone that kind of connects the occipital bone with the 2 parietal bones. Of course, you have the sagittal, which is this one right here. This little zigzag puzzle-like structure that you see here is called your sagittal suture, and it connects the 2 parietal bones. You also have a temporal line. I wish I had something to point with. Right above the temporal, it's really a part of the parietal bone. One at the top is superior, one at the bottom is inferior. Of course, your temporalis muscle attaches to it, which is one of your chewing muscles or the muscles of mastication, which you will see in a couple of weeks when you do your synovial joint movements. So muscles attached to that, you have 4 chewing muscles you need to be familiar with. The temporalis, your masseter, and your medial and your lateral pterygoid muscles. All right. See, I need to delete all of these pictures. I think that's why I can't upload these into Blackboard. So, which bone is this right here? What is this? This little point. acoustic. Okay, good. This bridge here. Okay, so the zygomatic process, what is this bone called? Zygomatic bone. This is your cheekbone, which is looks like an upside down T. You can palpate it right here. You can feel it protruding out. So this process right here, sometimes called an arch, it connects the temporal bone to the what? Zygomatic bone. The temporal bone has a zygomatic process, go figure. The zygomatic bone, of course, has a temporal process that allows the bridge to actually form here between the two. I probably should come back to this because I'm going to talk about the mandible. You guys know the parts of the mandible? I guess not, huh? Who can name these parts? It's on your exam. Okay, but anyway, let me move on. The temporal bone, like I said, there are certain parts I need to cover from it. Just mentioned the zygomatic process. You have a mandibular fossa. Okay. Anybody in here with TMJ? Okay. This can become disconnected from the temporal bone. Your mandibular fossa are these little indentions or holes here. Okay. So these little condyles that you see here on the mandible, they actually articulate or fit into the mandibular fossa. People that actually have TMJ, this is where it starts right here because this is a joint, okay? It's called the temporal mandibular joint. The temporal mandibular joint. When we get to chapter 9, we're going to talk about joints. Joints is where two bones actually what? Connect, okay? Temporal mandibular joint. What two bones? The mandible and your what? Your temporal bone, okay? You can actually palpate when you're opening and closing your mouth. If you hear a clicking noise, I have a mild case of TMJ. My joint, it clicks. You probably can hear it. Those that have severe cases of it typically don't chew gum. They have headaches. It's just a vicious cycle of pain. It's also called myofascial pain syndrome. A lot of times it's due to malalignment of this bone right here, which is your mandible, okay, that causes the pain. When you chew, you get the headaches and things of that sort. It's hard to treat it. People that grind their teeth when they sleep at night typically have TMJ. Of course, you can go to Walmart and buy a mouth guard, which would help with it. Oftentimes, you have to have an adjustment done to your mandible in order to correct it. Okay. You have your external auditory or acoustic meatus. You also have an internal acoustic meatus as well. You also have your what? Your styloid what? Process that you guys just pointed out. So there's that zygomatic process. I call it a little bridge. Okay. There's that temporal mandibular joint I was just sharing with you. They're showing you where the fossa is, the mandibular fossa on the temporal bone, and they're actually showing you where the mandibular condyles are on the mandible, which connects to what? The temporal bone. Okay. Okay, the mastoid part, mastoiditis, okay, which you will probably see on your test. Who can palpate the mastoid? Let me see you guys palpate the mastoid process on you. Everybody. I'm waiting. I'm waiting. The mastoid process. Put all cell phones away, by the way. The mastoid process. This little bump behind your ear, right? Some of you are looking at me like, what in the world is she talking about? You'll figure out in about another hour. There it is right there. So yeah, mastoiditis means what? Inflammation. You can get mastoiditis of the mastoid bone with mastoiditis. Very, very painful inflammation, severe earaches you get from mastoiditis. And of course you get headaches as well. I didn't bring my book in here. Can I borrow somebody's book? Mastoiditis from ear infections. And here it is for those of you that don't know. It's that little bump behind your ear that you can actually palpate. I call it a little notch. Okay, the petrous part, the only thing I'm going to cover for the petrous part, receptors for hearing and your sense of balance. You have an internal auditory meatus here. Now the internal auditory meatus is the opening for your vestibular cochlear nerve. When you guys take Anatomy 202, hopefully you guys will take Dr. Wilson. I will tell you now, your first lab exam will probably be on nerves. You have 12 cranial nerves, and you have your spinal nerves, and she typically will give you, coming out the gate in Anatomy 202. So I touch on them just a little bit. The vestibular cochlear nerve has receptors for your balance, okay, and for hearing as well. So that nerve sends signals up to the brain to help you keep your Your balance. It's cranial nerve 7. Typically with cranial nerves, you're going to use abbreviation CN followed by a Roman numeral, not a number 7. Cranial nerve V2I, which is 7. Okay? If this nerve gets severed, cut, or damaged, you won't have your balance, and you will also lose your sense of hearing. Okay, the carotid canal, the carotid artery, please make note of that in your textbook. What page is the carotid canal on? I need to go get my book. $239. Okay. No, I need text. I don't want the picture, I want text. Carotid canal. What's the role of your carotid artery? It drains blood from where? Leslie, you got it? You found it? About your carotid artery. Drains blood from where to, and it goes where?
A major blood supply to the brain. This artery is up close to the inner ear that one can sometimes hear the pulsing of his blood when the ear is resting on the pillow or the heart is beating heavy.
Yeah, so that carotid artery sends a lot of blood to the brain. Like she says, if you have your ear on your pillow, you can hear it pulsating, okay? Like your heart is beating or something. You also have a jugular foramen. What's a foramen? It's a hole, right? Nerves, arteries, blood vessels actually pass through it. This one, you have the jugular vein. This one right here sends a huge amount of blood from the brain to the heart. That jugular vein here, you have an external and you have an internal, one on the right side, one on the left side. People that say go for the jugular, they're about to kill you, okay? So they will cut that, they're going to cut that vein. You can lose a massive amount of blood at one time and die immediately, okay? So if you hear somebody says go for the jugular, tell that person to run. So there's your foramen magnum. Look, there's y'all's favorite picture, the one with all the words. The occipital condyle, these little knobs that you see here are your Your occipital condyles right here. Your occipital bone, guys, rest on C1, which is your Your atlas. C1, which is your atlas, allows you to say, I'm just going to pretend like this is the atlas. So the condyles, you have little flat surfaces on C1 that allows the condyles to kind of rock back and forth on top of C1, allowing you to say Yes. Okay? Remember that. The hypoglossal canal, of course, these are muscles that supply your tongue. That's your hypoglossal nerve, which is cranial nerve 12. Okay? cranial nerve 12. That nerve gets severed. Of course, you can't roll your tongue out. You can't move your tongue or anything. External occipital protuberance, which is that little bump that you see. I think it's on your test today. I need to bring that to your attention too. Some people, you can actually see it protruding out. It looks like a little notch sticking out from the occipital bone, which is the external occipital protuberance. All right. And you can actually see it here. It's this little bump here. I call it a little bump. Look at these muscles. Beautiful. Sternocleidomastoid. I think this is on your test. This muscle right here, which is your sternocleidomastoid. If you're ever in a car accident and you have whiplash, your head is going to hyperextend and then it's going to flex forward. When your head hyperextends back, you can actually damage or sever that muscle. It kind of goes around like that. It's a strap-like muscle, but anyway, it's another story. The optic foramen, okay, the optic nerve travels through the optic foramen, okay. This is your sphenoid bone. Your sphenoid bone, of course, is not visible. It's not on the surface of the cranium. You will have to actually remove the skull cap in order to see the sphenoid bone, which is this butterfly-shaped structure right here. Another thing is you need to remember, you need to know what the sella turcica is often referred to as your Turk's saddle. The pituitary gland actually sits in the sella turcica. The pituitary gland, of course, secretes a lot of hormones. Okay, you have your greater wing and you have your lesser wing. If you look here, these big wings are the greater ones. The little ones are your lesser wings. All right. This is kind of bothering me. Y'all, who knows why this is cut off? Y'all the computer generation folks. Let me turn this down. Okay, your alveolar processes are bony points between your teeth. Right here. These little bone fragments between your teeth, of course, are called the alveolar processes. The alveolus itself is called a socket. That little socket that you see is your alveolus that your tooth actually fits into. Okay, so my thing is, okay, you see the alveolar processes. What happens, what is the term, what have we studied in here? What have you guys learned from a previous chapter? I think it was chapter 7. When you get a tooth extracted, what happens to this little hole right here? All of a sudden it becomes smooth. It's no longer a little socket anymore. Where's your book? Oh, okay. Huh? Find the section in chapter 8. I don't have my textbook on the bone, the maxillae. It's in that section. Because you need to know when you have a tooth pulled why all of a sudden that area gets smooth again. See, this is just common everyday knowledge that you need to know. Blessing?
It says, if a tooth is lost or extracted so the chewing no longer puts stress on the maxilla, the alveolar processes are restored.
Bone resorption, right? Haven't we talked about bone resorption in here in chapter 7? Okay. And what else does it say? That was it, yeah. So what happens is, like you says, the bone resorption is going to actually take place. What page is that on, Blessing? 247. Yeah, bone resorption is going to occur. That's going to smooth that area out. And of course, your bone forming cells are responsible for that. Name your bone forming cells. Your osteoblasts, exactly. So your osteoblasts come in, lay down new bone, and then all of a sudden that little socket has closed, and you feel just a smooth, hard area back there. Okay, that's bone resorption, which is on your final exam, by the way. I need to tweak some of those questions. Most of your questions are from chapters 10 and 11. Okay. I do have a surprise for you. So we talked about the palating process, the hard palate, the palate that forms the roof of your mouth. It allows you to chew while breathing, and of course the cleft palate and the cleft lip that actually is supposed to be fully developed by 12 weeks of gestation. Here are your maxillary sinuses here that you can see. Well, actually they're showing you all 4 of them. Larger in volume than your frontal, your sphenoid, and your ethmoid. What sinuses? The thing about your sinuses, what do you guys know about your sinuses? What did I discuss previously about your sinuses? Why do we have them? What's the purpose of them? What happens? What do you know about your sinuses? Huh? Well, they lighten the skull. They make the skull really lightweight because of the little air pockets with the little air cells in them. Good, Kelsey. What type of fluid? Scott? I'm sure some of you guys get sinus infections in here. I know I do. Like I said, when the pollen count is really high in March, I can't even be outside for 15 minutes. I get a sinus headache. They give resonance to your voice, right? Because the sound has to travel through your sinuses, okay? So when you have a sinus infection or you have a cold or something and your voice starts changing and you sound nasally, it's because the mucus is obstructing the flow of the sound through what? Your sinus. So you really have a build-up blessing of mucus, not fluid. So yeah, the sound can't travel through it's like a clogged toilet or something, which means the sound can't travel through. So you have to open them up in order for what? The sinus to go, the sound to actually travel through, or take an antihistamine, okay? The palatine bone, whatever, is an L-shaped bone. That's all I can tell you. The zygomatic bone, I've already talked about that one. Looks like the upside down cheek. Teeth T, which is your cheekbone. You have zygomatical facial foramen, which is a little hole in that bone, and we talked about the arch, which is actually a bridge between the temporal bone as well as your zygomatic bone. The lacrimal bone, okay, now this one right here, this one is the smallest one. Out of all the facial bones, this one right here is the smallest bone of the, it says of the skull. It's about the size of your fingernail on your little pinky finger. Within your lacrimal bone, you have a fossa, which is a little indention or hole that houses your lacrimal sac. In your lacrimal sac, of course, you have a lacrimal gland, of course, where your tears will actually collect, and of course, the tears will flow. The tears can actually flow into your nasal cavity, which causes the runny nose. It's called the nasolacrimal gland or the nasolacrimal sac, which is associated with the nasal cavity. Okay. The nasal bone, there it is. A blow to the nose can fracture this bone.
I had one question about the nasal bone.
Mm-hmm.
Will you just go back to that previous picture and that one?
Right here.
You see where it says ethmoid bone?
Wait, and I need to put my glasses on.
That's the green bit, the ethmoid bone.
Mm-hmm.
But then it's also pointing to that green one on the other side.
What, right here? And here?
Yeah, but then
and here?
The other one says the middle nasal concha, and they're the same color, like why?
I think that's an error. Yeah. This right here, all of this green part right here is the ethmoid bone because it starts right here in the medial orbit of the walls and it kind of goes down into the upper nasal cavity.
So you can't really see your middle nasal concha.
Not really. Is it on another picture, that nasal concha? Like if you slice it and show the lateral view or something?
Yeah, it was on the picture and it was on 8.13.
8.13.
Yeah, that's right.
What does that look? I don't have a book, so I can't see that. My vision is very impaired. Can I see it? Can you bring it closer?
See.
What? Okay. So you have your superior, middle, and your inferior nasal concave. See, they're all associated with the ethmoid bone. That's why it's green.
Oh, okay.
Yeah.
Except for the inferior one.
Yeah, the inferior one is part of another bone. So these two, yeah, that's an error.
Because on mine it was like pointing right at it, and I was just confused for a little bit.
Mm-hmm.
Okay.
Because the inferior is back here somewhere. It's associated with another bone, but yeah, inferior nasal concave right here. But as you can see, it is a part like kind of associated. Well, it's kind of hard. They're all three, as you can see, in the nasal cavity.
Yeah.
But like I said, I think that was just an error with them pointing to that in your textbook. But yeah, you know the ethmoid bone goes into the nasal cavity anyway. So. Oh, my favorite. The largest bone, the only one that moves when you're yapping and you're talking about me behind my back. Strongest bone of the skull, only bone in the skull that moves noticeably. Supports your what? Your lower teeth. This one doesn't move. You can't notice it moving, but you can see that one moving. A lot of your muscles of facial expression and mastication actually attach to the mandible, such as your masseter, which is one of them. Temporalis, of course, is another one. The mental symphysis, which doesn't ossify until early childhood. Ossification just simply means bone development. I brought the little fetal skull up here because we're going to talk about the fetal skull. If you look at the mandible of this fetal, this bone looks like they have two of them. This part right here is the mental symphysis because it hasn't fused, completely ossified or developed into one bone. Okay, so that's why I brought this up here. Develops as two separate bones where in the fetus, and it ossifies in what? Early childhood. You can see the various parts of it. The mandibular condyles we just talked about, that inserts on the temporal fossa. The coronoid process, what muscle or chewing muscle attaches to the coronoid process? The temporalis what? Muscle, exactly. The temporalis muscle is really over the temporal bone. That's one of your large, it looks like a big fan-shaped muscle, of course, and of course it's associated with the coronoid process, which is a part of the mandible as well. The mental protuberance you can palpate, that's really your chin, okay? The body, the ramus, and the angle. Alveolar process, as we talked about, which is just bone between your teeth. The mental foramen, which is a hole in your chin. Nerves and blood vessels that supply your chin run through there. You have your mental spines. Mandibular condyles, we talked about your temporal mandibular joint. Mandibular foramen, okay? Mandibular foramen, which is this little hole right here. Okay. Clinical question. What is the purpose of this little hole right here in the mandibular foramen? It's going to be on your final exam. What?
It's the one that dentists commonly use, so it's like nerve and blood vessels that supply the lower teeth into this foramen and then travel through the bone and the body.
Okay, can you read that a little bit louder because you're mumbling?
Sorry. The nerve and blood vessels that supply the lower teeth into this foramen and then travel through the bone of the mandibular body, giving us branches to each tooth along the way. Dentists commonly inject lidocaine.
Lidocaine, highlight that. So when you get a tooth extracted and that dentist comes in there with that needle, okay, that's why. He says, I'm going to give you a little bit of numbness. I want you to feel numb so you won't feel the pain and jump out of the chair, you know. So they often use the mandible, I think the angle or the ramus, as your landmark when they're injecting medicine, because that nerve that travels through here, it branches out. Remember that trigeminal nerve, cranial nerve 5, branches out to all of these teeth. So he goes back here, he says, open wide. And then he goes back there and he just starts injecting what? Medicine back there. And then all of a sudden, one side of your mouth feels numb, whichever side he's working on. The same thing with the maxilla, with the upper teeth, okay? There's one for the upper teeth as well. So when he injects that lidocaine, if you're getting something done with your upper teeth, and it gets numb, feels like you're about to have a runny nose or something. Have you all experienced? Well, I went to the dentist Friday because I was chewing some bubble gum and broke a crown. So, and I know, and it was one of my upper teeth. So yeah, man, highlight that. That's clinical stuff. You know, I like to put clinical stuff on my exams. I just don't like to put information. Like you'll never see, you probably have figured my exams out by now. You'll never see anything about the coronary process. The temporal muscle attaches to it. Okay, great. And, or the condylar processes, blah, blah, blah. You know, I like clinical stuff. I mean, that's what it's all about. You know, you knowing the theory part of the, so when you get into the nursing program, you'll know. Three little inner ear bones, the malleus, your incus, and your stapes, or the hammer, the anvil, and the stirrup. The hyoid bone, of course, is this little bone right here. It does not attach to any other bone. It looks like a little hammock, as your book, I don't know if your book describes it as being that, but it's this little bone that sits right above the larynx, as you can see, between the chin and the larynx. It's just hanging. It does not articulate with any other bone. Here they have it attached to C3 right here. The styloid process, you have a stylohyoid muscle that actually the tendon attaches to the styloid process and the holding the hyoid bone in place. Often this bone, if someone comes and chokes you to death or strangle you, this bone often gets fractured, and pathologists, they often do an autopsy on this bone when they think someone has actually been strangled, because that bone is very small and delicate, and it often gets fractured. Fontanelles, okay. Here's a fetal skull. Here's an adult skull. You can see the difference. Okay, now, spaces between unfused bones. How many bones are babies born with? 270, right? Because a lot of them haven't fully developed, right? Adults have how many? 206. Someone said yesterday 45. I was like, this gonna be on your final exam. Okay. Make sure I put that question on my final exam. How many bones are in the human body? Okay. So you have these fontanelles right here, guys. You have the anterior fontanelle, you have your posterior, you have your sphenoid fontanelle that you can actually see, and you have the mastoid. And they're really connective tissue or membrane that's kind of, as you can see, look at all that space between the skull bones. Now we know that your skull bones, remember we talked about endochondral ossification, how cartilage is the forerunner before bone formation. Well, we didn't talk about endochondral ossification, which is the same process. Endochondral ossification, of course, is a process that for development of the skull bones and your what? The clavicle, and I didn't talk about it. The two frontal bones does not fuse until age 6. Right here, it's called a metopic suture. Looks like they have 2 foreheads, all right? So at 6 years old, this bone is supposed to fuse. You're going to see little fragments probably of this suture left behind, but it's going to become what? One bone. So the reason, why do you have these fontanelles? This one right here, this is your soft spot. They're called the soft spots. This one right here, this little pink one, is the last one to actually fully develop. 18 to 24 months. Some textbooks says 2 years old. This anterior fontanelle has actually fully developed. You can palpate it, feel that little soft spot right here in newborn babies. The reason why these bones have not completely ossified, why? Yeah, exactly. The head, okay, we're gonna, if you read the end of chapter 8, the hip bones, you have a pelvic inlet. This is on your final exam, by the way. I know this question is. You have a pelvic inlet and you have a pelvic outlet. The pelvic inlet, which is this big hole right here, the head has to, and you can see it can't come through here. So the head, these skull bones, they're going to shift a little bit. So they shift. That's why they haven't fully developed. That's one of the reasons why they have to shift or move a little bit in order to come out of what? Your pelvic inlet. Okay? And you have a pelvic outlet too. Another reason is to support the growing what? Brain. Yeah. So the skull of a kid doesn't reach full size until what age? That's in your textbook, by the way. 8 or 9, exactly. So can you imagine a 6-year-old, somebody under the age of 8, someone under the age of 9, whose skull is still developing, their brain is still growing, you know? It's pretty serious, okay? So that skull stops. That's why their little heads tend to look really big, bigger than the rest of their bodies. The skull stops growing. Well, it's in your book. They talk about those cartoon characters, you know, that have the really big heads and the little bitty bodies. That's the example they give in your textbook. But yeah, those are 2 reasons why. You need to highlight those in your textbook. It's time to stop, which is good. So we're making really good progress. I'm going to talk about the vertebral column. When we come back, the 33 vertebrae, and I think that's pretty much it. Like I said, I don't cover, I need to get Jim to come up here. Stop recording.